He had avoided any care for a long time and avoided treating the symptoms for a long time, so he just knew something was not right.
It sounded like there were some points of denial, and I think it finally took him to the point that he couldn't breathe very well, and his wife, pleading with him to come in probably made the big difference. I think he just really didn't understand how bad he was.
Typically, heart failure patients come in fluid overloaded, and in the past, and traditionally are treated with diuretics in the intravenous form. If that were to fail, this is a safe, effective way to remove salt and water from patients that are suffering from fluid overload.
I'm Julie Cerny of Methodist Health System, and I've been talking with a few of the cardiac care professionals who made it possible for one of our patients to receive Nebraska's first inpatient aquapheresis therapy at Methodist Hospital.
Aquapheresis is the system. The therapy is basically ultrafiltration, which has been around for years. We ultrafiltrate or unload our heart failure patients with the aquapheresis machine.
And I even drew pictures on the wall for him to understand that the large particles of plasma and blood are filtered through and returned back to his body. The smaller particles, such as sodium and the water, is what's put in the bag, the excessive fluids that he has in his body.
The first patient to receive aquapheresis was Dick Siebels, an energy company operations supervisor from Shenandoah, Iowa.
The blood would come out and go through that machine, and the fluid would drop in the bag, and the blood would come back. And it was amazing. I mean, I felt, after they took it off of me, that next day I couldn't believe how I felt.
It was wonderful to watch him. He just felt better throughout the day. His coloring changed, his mood changed.
He had basically said to me he felt like a switch came on, just like I told him, and he had felt 100% better. He was able to breathe, able to move, and he just felt 100%.
It's a comprehensive program that involves the dietitians and the cardiac rehab nurses and Carrie Loftus, the nurse practitioner, as well as all the nurses. These people are typically on the heart floor where we take care of all the heart patients, and so there's education sessions there when they're in the hospital, and all those things can follow up either in their local hospital, in his case where he goes down to Shenandoah, or they can follow up through the outpatient rehab. So it's a program that tries to encompass all the factors so that we have a successful outcome.
It's very important for the patient to know about a low-salt diet and the signs and symptoms to look out for as the fluid might start to build up again as an outpatient. So that's why patient education is so important.
I'm usually pretty blunt with them about what they need to do and why they need to do it, and I help them as much as I can along the way, but you can't make them do it, and that's always the hard part. They have to buy into the program, and when they do, the outcome is usually very good.
But it just trying to get down to his level where he can understand technical versus normal everyday street talk made a big difference in his understanding.
For heart failure, I think aquapheresis is an example of something that's made a big impact. It's not used very much, but when it's used, it can make a dramatic shift in the patient's care.
Dick did make the choice. He said, I'm going to do this, and I'm going to stay out of the hospital. And it's been quite a while since he's been back, and it's good to hear that he's doing very well.
The more times they hear, the more reinforcement that they have, the more likely it is to be successful.
I'm Julie Cerny, and this has been Heart to Heart. To learn more about aquapheresis and the comprehensive cardiovascular care available at Methodist Health System, visit us at bestcare.org.